So today marks 222 days. We're in week 32 since we had the first COVID-19 case back on March 13th, or March 12th. It was a Thursday. How can I forget? And it's been crazy times, and it's a roller coaster. And I wish I could sit here and tell you, and I know Dr. Whalen would like to do the same thing, that we have all the answers. We don't. We're trying our best to get through this, but it's still here, and it's not going away. And as much as people wish it away, it's here. And we have to think differently. We have to act differently. We had to reimagine what the workforce and colleges look like and re-educate people. And it's tough. It's hard enough to re-educate adults at a certain age, let alone children and teenagers and college-age kids. So it makes it tough. But we will be talking about that in a little bit because I have the honor of having University President Dr. Javier Rodriguez with us and intern College St. Rose President Marcia White. So thank you for joining me today. But I have to put out some other news first. And, unfortunately, we had 2 more Albany County residents pass away, which brings our total up to 138. One was a man in his 80s with multiple underlying health conditions. The other was a woman in her 70s, also with underlying health conditions. To the 136 families, my prayers and condolences go to your family, and to the 2 new families, my prayers and go to you and your family, and my condolences. It's a difficult time. It's difficult for everyone. So as I like to remind people, it's here, it's not done with us, and it's not going away anytime soon. And hopefully we do get a vaccine soon so we can start getting it out there to people, and we don't have to have, unfortunately, people pass away from this awful thing. As of today, there's 3,310 positive cases of the coronavirus in Albany County, 1,063 people under mandatory quarantine. We had an increase of 7 positive cases overnight. The day before, we had 16 new positive cases. So as of today, 3 have close contact with a positive case. 1 is a healthcare worker, and 3 don't have a clear source of infection yet. We have a total of 14,641 people who have now completed quarantine, and of those, 3,209 tested positive for the virus and have recovered. It's an increase of 11 recoveries since yesterday. There are still 10 people currently hospitalized with a hospitalization rate of 0.30% of those who have tested positive. Yesterday, the rate was 0.036. 2 patients currently in the ICU. Yesterday, that number was 1. I want to point out that we've had at least 1 patient in the ICU every day since October 7th. With the consistent numbers of hospitalizations for the past month, with an increase over the last few days. And as I informed people before, that's the one thing we look at in the control room for not just for Albany County, but for the Capital District. Yes, we're testing more people. Yes, we're getting out there. You're seeing higher numbers of people being tested in the state of New York every day. I believe we're the most in the nation being tested. So you can argue either way, but it's still here, and it's how it's affecting the people going into hospitals and ICUs and so forth. Over the last 5 days, there's been an average of 16.6 new positive cases each day. Yesterday, it was 19.6. And we saw when people do the right thing, it means that we keep it down. When you clean your hands and wear your mask and cough into your arm and stay 6 feet apart, it works. So please continue to do that. And as we continue to look at our hospitalization infection rate, we'll continue to put things out there. But our control room call on Thursday, Friday, and Saturday, and we were looking at the percentage, was on Thursday it was 0.7%, on Friday it was 0.6%, on Saturday it was 0.9% respectively. And as I have said this before, the governor has indicated we need to stay below 1%. If we go above 1%, I don't know what he's going to do if we start trying to shut down again. We know how that worked before, so we need people to continue to do the right thing. Like I said, we're testing more, but the percentage of positives that we have to watch. And we can't be getting relaxed, and that's the key to everyone. And I know it's hard. I know when you're out in public and you're out there, you have to stay vigilant, and you have to remind people. And if people aren't doing the right thing, please, by all means, stay away. And again, social distance yourself from them, and do all the right stuff, and we'll get through this. So we need people to get tested, whether or not you have signs or symptoms. There's plenty of places to go now, as we've been indicating, Dr. Whalen and I, all the great places in Albany County that are up and running now. And for those who are looking to get children tested, we have a listing on our Albany County website to help you. So go to our website if you're looking for your younger children to get tested. We also partner with the state to set up testing sites at UAlbany and the College of St. Rose students on their campuses in Midtown Albany last Thursday afternoon and Saturday, and that's why the respective presidents are here. There was 218 rapid tests that the students got done, but I'm going to let them share the good stuff because, it's like my job. You get the good with the bad, and when things are good, things are going good, and when things are bad, you take the bad with it. And I do want to say this to the two presidents. Thank you for the job you're doing. It's tough enough. You're running a university. It's small cities. Respectfully, you become like your own mayor and governor within your own compound, and you got a lot going on and a lot of moving mechanisms. And then you have kids from coming all over the state of New York, as well as the nation, as well as international students. And you have to re-educate them as you're giving them the foundation for their education to go forward, to brighten their future. You have to teach them how to learn differently, how to behave differently. And when you got an 18 or 22-year-old that's used to doing things a certain way, or the first time I freed them away from their family, that's tough. And we had some hiccups in the beginning. But I have to say that these two great colleges, the St. Rose and UAlbany, and amongst the other colleges, rolled up their sleeves to get things done and to do it right. And I want to say thank you for being a fabric of our community, for showing us the way, but hanging in there through these tough times and reimagine how you're doing everything. So I'm going to leave it to you two, but I'm going to start with you, Marcia White, and let you talk about your experience at St. Rose and what's going on with the numbers, because I think it'd be good coming from the two of you versus me.
Well, thank you, Dan. County Executive, I'm really very grateful to be invited here along with my friend and partner, President Rodriguez, and Dr. Whalen. These are extraordinary times, and extraordinary times call for extraordinary decision making, and I want to share that I know that you have based your facts, your science, but you always put people first. You've always put the people first of Albany County, and we all owe you a tremendous debt of gratitude and profound appreciation for your leadership, because that's what it takes. I am proud to join President Rodriguez, and at St. Rose, I actually took this position a week before COVID started. But I will share with you that we all feel it's a calling, and I wouldn't be anywhere else. I'm a former registered nurse, but being an 18-year trustee of St. Rose and a graduate and alum, my heart and soul is here. And we are a campus within this city. We don't have walls. Our sidewalks are the city sidewalks. We have university partners at Albany too, and we recognize that in the pandemic, our location gives us even more responsibility. And the testing that was done, it's not just about students, it's about making sure that the residents of Albany County and Pine Hills feel safe, and the fact that we will help stop the spread of COVID. This was also a tremendous example of what true partnership, collaboration across public-private sectors, higher education, and local government. We did 218 tests within 2 days. Every test came back negative. The students received their results within 30 minutes, and it was a win-win for all of us. The collaboration also included New York State Department of Health, nurses from Albany Med, St. Peter's Hospital, volunteers from all over. And again, I want to thank Dr. Elizabeth Whalen and her staff for making sure that this happened, and the fact that you're tireless in this effort. Lisa Haley Thompson, my chief of staff, was there, excited to partner, and always made sure everything was done and done on time. But I consider our students heroes in this pandemic because we have the values of St. Joseph of Carondelet on our campus, and that one of the values is to care for your dear neighbor, and they're doing that. They recognize that the responsibility isn't just to their other students, not just to the well-being of the faculty or staff, it's the entire St. Rose community, and that is our neighborhood, and that is our county. We know this because they also realize there are consequences if policies and protocols aren't followed. The Student Athletic Association Advisory Council actually drafted and signed pledges, pages and pages of pledges as ambassadors, sharing that for them, having masks up and being social distancing, it's not only filling me with optimism, but also great hope for the county. But I just want to share one more thing, is if you have read the New York Times on Sunday, many of the outbreaks are now more from family, social gathering, and the term now is public awareness and pandemic fatigue, and that's what's happening. But we can't let our guard down. We have a saying at St. Rose, it says, show love, masks up. And we all have to do that. This is not the time to be complacent. We have to give it our best because we all deserve it. And if you think this is life and death, it is. And I thank the county executive for his leadership. He has your heart and your well-being in first on his mind, and I'm thank you again for partnering with SUNY Albany and certainly with you.
Thank you, President White. I appreciate the kind words, and it has been a great partnership with everybody. And talking about great partnerships, it's been great working with you before this, and now even closer. And I want to say thank you again, but I know you have a lot to say, and you should be proud of the way your students been handling this.
Thank you, County Executive McCoy. Dan, it's great to be here. Commissioner Whalen, as always, it's a great pleasure to see you, my dear friend. President White, it's always good to see you. And it's great to be here this morning. The pandemic has been relentless, right? It has not stopped, and it will not stop anytime in the near future. But Albany County and the Albany County Department of Health, their work has also been ongoing, significant, and impactful. And we owe a great debt of gratitude to Dan and the Commissioner and your staff for the absolutely great work that you are doing. So thank you so very much on behalf of you, Albany, and our community. We really appreciate all the work that you do, and we strongly, strongly value our partnership with St. Rose and the ongoing conversations that we continue to have to continue to enhance the health, the safety, and the well-being of our communities, both off and on campus. I just want to start by thanking Governor Cuomo and his staff, our SUNY Chancellor Malatras, and especially the New York State Department of Health and the Albany County Department of Health, without whose resources and expertise this testing that we conducted last week would have not been possible. Also, as President White said, we need to express our appreciation to St. Peter's Health Partners and Albany Medical Center for making clinical staff available to conduct these tests. And our appreciation goes to dozens of staff both at St. Rose and UAlbany who helped us make this operation go smoothly. And finally, thank you to over 100 UAlbany students who answered our call and got tested. Their engagement demonstrates that our university is committed to the health of our broader Albany community and especially to our neighbors in Midtown. Because they exceeded the challenge that we set, the University at Albany Foundation will make a donation to the American Foundation for Suicide Prevention, an organization selected by our students who were tested at these sites last week. We are also clearly very pleased that there were no positive tests. But as President White said, this does not mean that we can let our guard down or become complacent about what we need to do. We know that the number of COVID-19 cases continues to increase at an accelerated rate across the country. But we also know what we need to do in order to prevent the spread of the virus. Wear masks, maintain physical distance, avoid large gatherings. If you feel ill, stay at home and get tested. And so at UAlbany, we continue to strongly focus on our mitigation efforts. We continue to ramp up our testing capacity to learn as much as we can about the virus's presence in our campus community. We just passed a major milestone with our pool surveillance testing program with over 11,500 saliva samples since September 1. As of this morning, the RNA Institute has analyzed 11,529 saliva samples with a presumed positivity rate of 0.56%. And positive cases that we identified were promptly acted upon for diagnostics testing, quarantine, and isolation where necessary. Our campus is also pilot testing, wastewater testing to see what kind of data we can get from that and if it allows us to continue our mitigation efforts. Next month, we will also move from bi-weekly to weekly pool testing of all students, faculty, and staff coming to campus. This is truly a proactive measure, especially given that we're entering the flu season. And we're also encouraging our community to get a flu shot, and we have established flu shot clinics on our campuses as well. One of our goals for last week's testing events was to leverage them to distribute surveillance testing kits as well to our students living in Midtown who might not otherwise have a reason to come to campus. And I'm very happy to report that the majority of them already had their test kits, but those that did not walk out without a test kit. So now, with a little more than 5 weeks left in the semester, our greatest challenge might still be ahead of us as we transition to colder weather and, as President White reported, the COVID-19 fatigue. But our experiences over the first 8 weeks have reinforced two important points: that our campus is not immune from the impacts of this pandemic, and that we have the ability to manage the situation if we follow the advice of experts like Dr. Whalen and her staff, if we act responsibly and we work together. The fact that you are seeing us sitting here again is a strong commitment of the partnerships that we have, that we're committed to work together to improve the safety, health, and well-being of our campus communities, but also of our surrounding communities in the city and the county throughout the rest of the semester and beyond. And we are very positive that we will get through this, but we will have to do so together. Once again, Dan, thank you so much for the invitation.
Thank you, and thank you for your leaderships at your respective universities, because again, this is great news, and I thought it was best for these two presidents who have rolled up their sleeves and have worked with the community, worked with our health department, Dr. Whalen and her team under her leadership and everyone else's leadership, and got it done. And I thought, who better to say it than the two of you, because when you test that many students, 218, and they come back negative, you don't know which way it's going to go. And again, they're getting the message, and we're getting it through them, and we're continuing to move on. But I do want to thank Dr. Welling for everything, for her leadership through this whole thing and everything that's going on, because these are difficult times, and we have to work together in a partnership. And I know people are going to get tired of me saying that. Partnership is how we get through it, regardless of party affiliation, just working this through, because we're all one at the end of the day, and we have to take care of one another to get through this, and we can get through this. Like you're saying, 5 weeks left. I want to say that to Liza, it feels like they just started school, the other day, and her wearing two hats as a mom with kids in school, and then being the health commissioner, and then this, I can't believe it's only 5 weeks to the school semester is over with. But I do want to say thank you again I want to remind everyone that the testing is free at the state testing sites at the University of Albany. You can schedule an appointment at 1-888-364-3065. Our great partnership with Whitney Young mobile testing sites, also available testing available for kids if they have symptoms or if you've been exposed to a positive case. Please call the appointments office there at 518-465-4771. Some of the CVS stores have the drive-through testing. The location's at 885 Central Avenue, 3916 Carmen Road, or you can go to the CVS website and look it up and sign up for that. OmniMed urgent care locations offer nasal swabs and antibody testing at multiple locations, along with our good partner Priority One in Gilderland. You can go there also and get the antibody testing done at 518-867-8040. And if you're looking for a rapid test in Albany County, you can go to Central Med Urgent Care on Central Avenue, Community Care Physicians in Latham. Both will test children, so the parents know that. Rite Aid in Colony has the drive-through testing, but you must go online at riteaid.com to make an appointment. And there's rapid testing at Walgreens on Holland Ave in Albany. You have to go online first at walgreens.com/findcare/COVID-19/testing. So, as you can see, we have continued on. More and more sites are popping up. Yes, the higher numbers being tested, and I'm glad that our numbers are where they're at. Again, we have to watch the hospitalizations. But Dr. Whalen, I don't know if you want to add anything before we end.
Can you hear me? Okay. I would like to thank both of the presidents, President White and President Rodriguez, for their cooperation on this. These conversations, as many of you know, started with the concern around an outbreak that was related to students that were living off campus, and we really started to have these discussions to determine what we could do in a broader sense as a larger screening. And from the get-go, President Rodriguez was very interested in doing that, and then President White in the St. Rose community also joined in, so we would really get an opportunity to look within the Pine Hills community. So this was a big partnership with both the university at Albany and St. Rose, and also with our partners at the State Health Department, who were very integral in organization and implementation of this exercise. And we also had, as has been indicated, the help of both of our major hospital systems, Albany Medical Center and St. Peter's. So this is a great example of how we, in local government work with these multi-sector partnerships to come up with, a way that we can get a better idea of what's going on through the pandemic. And I just have to say that all partners really worked together so well on this. And I thank County Executive McCoy for his leadership on being able to implement something like this. As you heard, there were no positive results from the testing that was done, and this is very good news. I will have a slight addendum that there were 4 tests that were indeterminate, and those individuals have been suggested to be retested. Indeterminate tests can sometimes occur if there's a sampling problem or if someone has not yet made enough antibodies to create a positive test. So those are not positive tests. We did not get any positive tests, but I just want to be 100% accurate with the results that we got. I think overall this was a great effort, and again, I'd like to commend all involved.
Thank you, Dr. Whalen, as always, for your partnership and your hard work down at the Department of Health. Again, please wear a mask, socially distance, cough into your arm, stay 6 feet apart, and we'll get through this, and wash your hands frequently and get tested. So as always, I want to remind people that mental health is available 7 days a week from 8 a.m. to 5 p.m. The number is 518-269-6634. To the men and women handling that through Dr. Giordano's office, thank you. It has been uneasy for a lot of people, and unfortunately, we've seen suicide go up and drug overdose overdoses go up through this tough times we've been through, and we'll be talking about that down the road. But please call. Don't be afraid to call the mental health hotline and to talk to them, whatever you need to talk to them about. That's what they're there for, you know. And again, we'll get through it. People handle things differently, and I just want to remind people that people's stress levels different than anyone else's, and that's why I say take a step back. It's a marathon, not a sprint. We'll get through it working together, but we're not going to get through it by pointing fingers and saying, hey, you know, why can't you deal with this or deal with that? You just got to put yourself in their shoes and you know, and try to give them a shoulder to lean on and talk to them. And I'll say to everyone out there, reach out to somebody, your neighbor, your friend, or friends you haven't talked to that are having a difficult time, and let them know that you care about them and you're there for them, because it's been a tough time. And like I said, our suicide rate and drug overdoses is going through the roof, and it's something we have to address on top of this too. So again, thank you for the partnership with our two great presidents. You know, I can't thank the two of you enough for everything that you do in the community. Love working with you, and you know, it's a nice outcome that we're having and we'll continue to have. Our 24-hour sexual assault hotline number is available, 518-447-7716. As always, our 211 number with United Way and the New York State hotline, as always. Thank you again to these two great universities and everyone else in the Department of Health.